It is just a huge honor for me today to be podcast interviewing Dr. John Hagiliassis. It's 12:30 in the afternoon on a Friday here, and it's already 6:30 in the morning Saturday where he is at. So you're already a step ahead of everyone listening to you. John graduated from the University of Melbourne with a Bachelor of Dentistry in 1998. He founded Freedom Dental, a South Melbourne-based dental clinic in 2011, which quickly listed on the BRW'S Fast 100 business in Australia for years 2011 and 12. With a true passion and commitment to customer service and cosmetic dentistry, Dr. John and his team of over 50 staff treat thousands of patients every year, providing them with straighter, wider smiles and a spa-like environment, and providing personalized care and 6-star service. I love that 6-star service. I never even heard of that before. 5 stars as high as it gets over here. Dr. John is the largest provider of Phillips Zoom whitening treatment in Australia since 2012. He absolutely loves technology and loves finding ways to incorporate it into his practice to make it more accurate and efficient. Many years ago, John was one of the first people to have an iTero scanner in the world and has continued this trend by updating his technology constantly. He's treated over 3,000 Invisalign cases to date, is an Invisalign international mentor, and the 4th largest provider of Invisalign in Asia, and the largest dentist provider in Australia. His passion for cosmetic dentistry saw him further his education in 2017, completing a graduate diploma in aesthetic orthodontics at the Postgraduate School of Dentistry. Committed to advancing the professional development of his team, Dr. John runs ongoing study group sessions for all staff at Freedom Dental, including the leadership team, dentists, oral health therapists, administrative assistants, and treatment coordinators. Freedom Dental hosts professional development seminars for the wider dental industry, inviting clinicians from across all specialist fields to speak and share their knowledge and expertise with the audience. John regularly speaks and mentors at the Postgraduate School of Dentistry, as well as for Ivoclar, Trios intraoral scanning, and 3D Meditech. John is the founder of Aesthetic Orthodontic and Restorative Training, AORTA, which aims to promote the further education of dental clinicians in the new field of digital dentistry and aesthetic orthodontics. Outside of dentistry, John keeps a busy life in fitness with particular love for running. John is a busy father of 2 amazing boys, Andy and Dean, and husband to the gorgeous Joanne. With one of his boys being diagnosed with anaphylaxis to nuts, John and Joanne have been strong and continued supporters of various organizations and charities to improve understanding and treatment of such conditions. So how old are Andy and Dean?
They're 11 and 9.
Oh, those are fun years. Those are very fun years. My gosh, my oldest grandson's 10, so that explains why you look so handsome on YouTube, and I only want my people to see me on iTunes. So, where do you think your passion for technology comes from? Was it video games when you were a kid?
No, definitely not. I think I've surrounded myself with people who know how to use technology. I just see it as a way of improving the experience for the patient. So I think that's my drive, that's my passion in seeing dentistry advance. And at the end of the day, we sometimes forget we're treating patients, and it's making their experience, especially in the world we live in now, better, and the technology is there to serve them. But I think our profession is generally slow on the uptake, and we often forget what's in their best interest. It's not just the oral care and the health, but it's also how they feel at the end of the day after the procedures.
You know, I've lectured in Auckland, New Zealand, Sydney, Melbourne, Perth, Adelaide, Gold Coast, probably every 5 years for 30 years. And my God, Australia has became so competitive. Since I started going down there, they doubled the number of dental schools. The government let in 1,000 dentists from around the world. My gosh, there's only 3 publicly dental traded DSOs in the world. 2 of them are in Australia, one's in Singapore. It's 1-300 Smiles and what is the other one? Pacific Smiles. The Australian dental market is twice as competitive as it was a decade ago. Can a new kid coming out of dental school in Australia still grow up and be like you one day?
Yeah, look, I think it's tough, right? And I think dentistry in Australia is definitely changed, and it's a corporate landscape. But I think if the new grad is true to themselves and true to how they want to feel as the patient, I think there's always a move. There's always a niche, and there's always going to be a need for dentists who care about their patients and want to communicate with their patients. I think that's where my success has been really tapping into that new generation of consumer, not just patient, who wants a say in what they're going to have done to their mouth, whether it's health or aesthetics. So I think there's hope as long as they're willing to embrace technology. Now, I know technology comes at a price, but I think it all comes down to where we see ourselves in 20 years practicing dentistry. I think if you think about when you started, what you were doing compared to what you're doing now, it's changed significantly, and it's going to continue to change exponentially. So I think if the new graduates, they have an advantage over us older dentists. They can embrace this technology a lot better than we can. So I had to get my associate to just make sure this Skype was all working for me. So if they want to embrace that technology to better service their patients, I think there's a bright, optimistic future. But I can appreciate them feeling a bit of doom and gloom, with the debts they've got, their tertiary education debts, they continue to increase. It's a bit overwhelming for them. But I think if they stay true to why they got into the profession, have that passion for it, I think anything's possible. And, I think innovation is what we need to develop in dentistry, in any profession.
The first three technologies that were a must-have was bullwhip, hammer, and chisel. And so now, 30 years later, what do you think is the must-have technology?
Oh, look, I think intraoral scanner. I mean, I got the iTero in 2010, and then I've upgraded the Trios. I've tried them all, 3M, Plemeca, all those scanners, Carestream. The intraoral scanner, to me, is completely rejuvenated our practice from 2010 and given us that ability to tap into ortho software and crown and bridge and implant. So the scanner to me is a must. An intraoral scanner integrated into your practice, just for speed, efficiency, but also the comfort for the patient. And then you've got this record of their teeth that I foresee in the future we'll be able to replicate and use and 3D print porcelain restorations and fillings based on natural anatomy. So I think the intraoral scanner, we haven't really tapped into that potential as to what it's going to provide us in the future.
Well, go through all three of those. You started with an iTero, and then you talked about an Ivoclar Trios intraoral scanner, then a 3D MedTech. Talk about the iTero. You still love that? You still use that?
Look, the iTero is more now restricted to Invisalign cases that we do, but I found, unfortunately, that was a great product when it first came out. It was bulky, yes, but its ability to scan efficiently and effectively was fantastic, and the accuracy of the restorations coming back from 2010 was fantastic. And we ended up getting 2, 3 within a couple of years because we grew so quickly. We were scanning and getting software back within 24 hours rather than waiting 2 weeks, especially from Australia, shipping out these impressions. It completely transformed systems and the workflow of our practice. So the problem was when Invisalign then bought iTero out, they didn't focus or invest in the crown and bridge aspect of their workflow. So Trios then came on board, and it's like an iPhone, it's like a smartphone. It's the software that you can use, and I think Trios have done that very well with their software. The ability to make in-house porcelain restorations and smile design as well, which is a big buzzword at the moment, digital smile design, but the ability to use a software to design smiles and show that patient and communicate with that patient transparently what we're trying to achieve, I think is what's giving them the edge over their competitors.
Well, you're calling it the Ivoclar Trios intraoral scanner, but Trios is made by
Ivoclar is just a reseller. Ivoclar is just a reseller.
Okay, so, yeah. So you're talking about the Trios. Trios. 3Shape. Trios. They're out of Denmark, right?
Yes, they are. Yeah.
Yeah, and Align Technology, you're saying, who owns Invisalign, also bought iTero, but you're
Correct,
saying that in what?
In 2011. So I got the iTero before that happened, and was using the crown and bridge and haven't looked back. But then, once Align bought them out and we were able to scan directly at that time, we were the first in the world scanning. We had 2 scanners, and I remember the IT departments at Align at the time, iTero at the time, we couldn't send 2 cases simultaneously. So my IT guy had to speak to Israel, who were the creators of iTero at the time, to work it out. That's how new it was.
So iTero was originally out of Israel?
Israeli military, is what my understanding was. They created technology back in, I think it was 2009, but I saw a demo of it in 2010, and within a month I had to have it. I saw the future, and I didn't look back.
That is amazing. I never knew. So the I in iTero stands for Israeli, huh? Israeli?
Possibly. I'm not actually sure.
That is it. I did not know that. So yeah. You're saying that when Align, who owns Invisalign, bought iTero from Israel, that they really just focused on the orthodontic and quit focusing on the crown and bridge, which
they've gone back to it, but they haven't invested. They're way behind.
So that's why you went to the 3-shape. So my question is, can you scan with the Trios, the 3-shape Trios, for clear aligners and send that to Invisalign?
And you can do that yes, you can. I know in the US recently you can't, but in Australia we're still allowed to send with either scan. Yeah, we can send it to the Trios to Align, and they'll accept it.
So when you're doing Invisalign, which is your go-to? 3-shapes Trios or iTero?
Whichever one's available. We have 4 running.
So it doesn't matter to you?
Doesn't matter, no. So we have our assistants, our nurses who are scanning for us, as well as taking the photos. So it's a whole workflow where whatever machine's available, often we'll have 4 people needing the machine at any one time, or there's a waiting list for it. So out of the eight surgeries that we run, so whichever one's available. So we have it's not much of a difference from that point of view.
So what about cost? Overhead cost. What do you think of the difference between the cost of taking vinyl polysiloxane impressions versus a scanner?
Look, it's a no-brainer from my perspective, and my figures show that in terms of the remakes of crowns. Let's talk about crown and bridge first. I mean, the remake of crowns, I hardly need to adjust, modify, and often when it is, it's because I didn't scan properly the occlusion or the bite. So remakes, you probably send, 1 in 20 crowns back, or have to adjust 1 in 20. Inserts are for me of 10, 15 minutes at most for an individual crown. So it's saving you time from that point of view. But the focus has always been the patient. So how many patients do you see in your surgery, or how many dental practices do you see advertising the gag? I want a gag on that polyvinyl siloxane material. No one wants it. Patients don't want it. Patients want comfort. And to be able to show them on their screen those amalgam fillings that are still in their mouth, not to mention how easy it is for them to have it done. It's a no-brainer. So if the patient is our focus, the rest falls into place. It's a more efficient way, so it saves me time, allows me to communicate to my patient what I'm doing and what I need to do for them in the future. It creates a medico-legal record, so it's saved in the cloud and can be accessed any time. So when you look at it from that point of view, yes, there might be a cost if you're doing, PVS impressions for 20 years, but it just takes time. You have to invest in that technology and know in 20 years' time, impressions will be something in a museum. They won't be something that will be around, because scanning will be the way that we communicate to our technicians, to our third-party orthodontic labs, and also as ways of recording data and records of the patient. So to me, it's a no-brainer. It's not even economically, it's made sense. I have them back. You've seen the growth of our figures. It allowed us to explode and gave us an edge in patient service and chair time.
Whenever I meet someone like you who's, done, 3,000 Invisalign cases, I know you're a passionate dentist. You love technology. You're a great dentist. My homies down in Australia, we're so excited I was going to podcast you. But you got to present this treatment. And dentists always tell me they don't like selling. They say, I didn't go to school 8 years to learn how to sell, and they just don't want to. It'd be like me going in to the doctor and he's saying, you should get a cosmetic surgery, or you should wear a wig, or you need a tummy tuck, or whatever. How do you think any of this technology helps you with presenting the cases? I mean,
Oh,
how do you close 3,000
so
Invisalign
it's
cases?
been the key to success. The key has been using the technology to communicate to the patient. I'm still surprised. I mean, we get cases from all over the world that are continuing Invisalign and they're living in Melbourne, for example, or cases they've transferred. I cannot believe how many times these patients come in and I review the software with them, and it's the first time they are seeing the software. It's incredible. It's mind-blowing. Why do we fear showing the patient what we hope to achieve rather than using it to inspire them to see this is what you're achieving, this is what we hope to achieve, this is what you're working towards? It becomes a way of motivating them to wear the aligners because it's a collaborative effort. We can set the software up any way we like. Unless they wear it, it's not going to work. So closing those cases becomes easy. We bring the patient, we're not talking down to them, we're talking to them, with them, and working on a solution. So using the technology to show them what we can do, where the problems may occur, what they have to focus on. That's been a key to success. It's communicating using the technology. So the technology is two things. It's the clinical advantage of diagnostics and treatment planning, but it's also the communication with the patient. To begin with the treatment, but every time that patient comes in for their aligners, they are seeing their software, they're seeing their progress, they are communicated what the next step's going to be and where their focus has to be. It becomes, a win-win. So it's a technology. It's empowering the patient to see and support them on their journey rather than telling them where we're doing, or trust me, I'm going to put braces on you and you'll have a straight smile. They're getting to see and interact with that process. That's been the key to success.
If you want to follow this young man, he's on Twitter. He's at freedom_dental. I just retweeted his last tweet. His Twitter, we aim to bridge the gap between dentistry, artistry, and hospitality so you can experience a day spa for your smile. Call 1-300-4-FREEDOM to release your smile. I love it. Is that why you named it Freedom, the freedom to release your smile?
Yeah, I think that's where it evolved. I mean, we had a pretty, before Invisalign really became huge, or clear aligners became huge for us, we were focusing on a patient-driven or patient-focused philosophy. So, the wants versus needs mentality, where patients come in wanting something, they've got a missing tooth. And the mentality of dentists in general is to focus on what they need. The care is on that upper molar or something that's not visible. So that's where it evolved from. I didn't like the way dentistry was presented. I was in undergraduate and I could see this disconnect between patients, how they want to feel and what we're telling them. So that's where it evolved. So the freedom then evolved from there because we were Albert Square, which was a locality name, Albert Square Dental, from the early 80s. And as this evolved and exploded for us, we thought freedom was a perfect fit. The name and as a philosophy, embodying our philosophy.
So now, can you schedule an appointment on your website, or do you just leave contact information?
No, there should be appointments available. We're actually upgrading that shortly to a new platform that has all our appointments. So we usually focus on appointments for the therapist as initial contact, but we're now opening that up with a new interface. Actually,
that's a new deal in dentistry. How long have you been doing scheduling your own appointment online without talking to a receptionist?
About 18 months. And we
18
have
months?
about 18 months, and live chat too. So patients have an inquiry, they can just go online and chat to our receptionist. So we have a call centre actually at our practice where we have reception/admin staff that are in that area dealing with all inquiries, not just phone. Because the reality is the new generation don't want to pick up the phone. They want to text.
Have you been saying 8 months or 18 months?
18, sorry. About 18 months.
So 18 months you've been doing live chat. You have your own call center, schedule online. See, this is an amazing stuff. So as far
as patients want, right?
But as far as scheduling online, how has that been? I mean, has it been significant? And what about like live chat? Has that been significant?
Yeah, look, live chat has definitely been significant. Whether it's Facebook or Instagram, interactions, that's been significant. The online bookings, we've done it cautiously. So my book, for example, isn't online. yet because we haven't quite worked that out. So we're looking at a new software that will help assist that. So the appointment books has been a steady increase for our I guess our junior dentists and therapists, where their books are not as full as the senior. So that's been progress, and I can see that really taking off. But the live chat's really been significant.
So do you think the live chat is more significant than the schedule online?
Yeah. The ease of communication without having to speak to someone. Yeah.
And the person chatting is actually your own receptionist in your own office?
Of course, yes.
And what software are you using for that?
We use a program called Dental for Windows, and it's a link off that.
Dental for Windows?
Dental for Windows is the appointment book software. It's an Australian brand, and we're about to change that. We're looking at changing that to a new group that are cloud-based, also Sydney-based, called ClearCorrect, where fantastic software where it's a lot more interactive, the appointment book and scheduling.
And it's just for they do just for dentistry? And what's the name of that company?
The new one is called ClearCorrect, I think.
ClearCorrect?
Yeah.
ClearCorrect. And what was the last one? The one you're using now?
Dental for Windows.
Dental for Windows. Is it the numeral 4 or spell out 4?
Yeah, 4 numeral. So
numeral 4. Numeral 4. Dental numeral 4 for Windows. Yeah, this is. What we see in the United States is that for every 100 people that land on a dentist's website, only 3 are going to call. But if you add live chat, maybe that turns into 6. If you add online scheduling, maybe that turns into 9. On your call center, is that a 24-hour, 7-day-a-week call center, or is it just business hours?
No, only the operating hours, so 7 till 6, Monday to Friday and Saturdays. But look, at the end of the day...
So your hours are 7 a.m. to 6 p.m. Monday through Saturday?
To Friday, and Saturday is 8 till 3.
8 to 3.
But we have, staff, committed, dedicated staff that will take inquiries. Like if someone's on Facebook at midnight on a Saturday, usually someone will get back to them first thing Sunday morning. So the beauty of technology is everyone's got a smartphone. The ability to communicate to a patient or a customer who has an issue, pain, as well as a new inquiry is at our fingertips.
I asked my staff if they wanted a smartphone, and they said no, they wanted a smart dentist.
They don't need a smart dentist. They just need a smart team around that dentist.
Well, so for a person to do 3,000 Invisalign cases, I mean that's impressive. I mean, Asia is what, 3/5 of the world's there's only 1 billion people in the Americas, North and South. There's 1 billion in Africa. There's 1.2 billion in India. There's 1.3 billion in China. So for you to be the 4th largest provider of Invisalign Asia, I was so excited to get you on here, and it sounds like that these technology, the iTero, the 3-shaped Trios intraoral scanner is a big part of presenting and communicating to the patient of why you're selling these. And it sounds like in order to get this volume of patients, you're just highly sophisticated. Your website has live chat.
And what's amazing about that, it's the approach. It's not just setting up a dental practice and saying, come here, I'll help clean your teeth, fix your teeth, and I'll tell you what you need. Patients search for what they want. They search white teeth, white smile, straighter smile. We've just tapped into that. And what we've found amazingly with the growth, it's not that they come in for aligners. They come from aligners and then they want whiter teeth, they need clean, they have perio issues, they have endo issues, they have wisdom teeth that are going to be removed. Then there's aesthetic augmentation, there's bonding to the teeth because we only can align the teeth, then we can improve the shape. And by using the software constantly, they're seeing, hey, look, that tooth doesn't look, now that it's straight, it's not as symmetrical, that lateral, the lateral tooth, is a different width. Then all of a sudden, the technology is helping them see what they want. We're not pushing, we're not selling, we're just showing then what's possible. So it's the whole package. It's provided a way of helping patients improve their smile, and then it brings in all the other dentistry rather than telling a patient what they need, and then it's doing it back to front from the patient's perspective rather than the dentist's perspective. We focus on health and stability and occlusion. That's all well and good, and it's all necessary. But from the patient, they see it the other way around, and that's how it's been successful for us.
And that's amazing because so many dentists tell me, and I ask them, are you dentist focused? Is it all about you, or are you patient focused? And they all say patient focused. And I say, okay, what are your hours? And they say Monday through Thursday, 8 to 4. And look at you. You're Monday through Friday, 7 a.m. to 6 p.m. I mean, you're open 11 hours a day for 5 days, and Saturday you're open 8 to 3. I mean, the only dentist that I know that are open on Saturday, it's maybe one Saturday a month, and that's only if they have several $100,000 of student loans, a stay-home wife, and 3 kids running around. But if they're single, no kids, not a chance they're open Saturday or Sunday. So are you still using, what practice management software do you use to run your office? Is it
It's the dental for Windows. It's all-inclusive software. So currently we're using those same softwares that we spoke about for the appointment book all have, the accounts and the charting and the patient record. And we're actually transferring that to this new one called Core.
Did you find that one, the next one?
It's not Core. It's
okay, CORE practice?
Correct.
Are you holding your software in your office on servers, or did you switch all that off to the cloud?
So we've got servers. I never thought when I started, really expanding, I'd have an IT room. So we've got an IT room. So there's a server for the radiology and the CBCT. There's a server for the patient records and photos. And we have a photo studio as well. So there's a lot of data that's been collected. So we're transitioning to cloud, but we're going to always have a server as a backup. So as these records transition to new software, very important. So it's called Core Practice, by the way. It's called Core Practice.
Yeah, we found it. But is your servers more a backup, or is the issue that when you're starting to use scanners, iTero, 3Shape Trios, that these data files are so huge that they don't really make to back up on the cloud? Some dentists say that the files are too big. Is that the issue in Melbourne or not really?
Yeah, definitely still an issue. The scanners, I think when we want to tap into it, there's a site that's in cloud through the provider. So whether it's iTero, whether it's Trios, they have a cloud-based system where the scans can then sit there. So I don't think anyone's really found a solution to that yet, but I foresee us all having the scan accessible through our dental records like an X-ray is or a photo is. But you're right, the file is too large for that to be something that you can now have on your computer. But we're going to need to use it. I mean, it's amazing data. You imagine an 8-year-old who you've scanned and then now chip their central incisor. In the future, no matter how good our dentistry is, we don't want to have to try and copy nature. Imagine the ability to go back to that original tooth and emulate nature by 3D printing or milling a restoration to replace what was already there. So these scans have got huge potential. We just haven't tapped into it yet. The technology hasn't caught up yet. So those scans will be something we'll be scanning. I foresee every new patient will be scanned with an intraoral scanner, STL file, filed away for future reference, whether it's to replicate a tooth that needs repair or for just collation of records for orthodontic needs. The whole host of reasons why this scan becomes important, but we haven't worked out how to save that effectively. So it's pretty much a cloud-based other server or third-party server rather than a practice having to worry about saving it at the moment.
Another issue, you're the largest Invisalign. Are you still staying loyal to Invisalign? Because now that the patents have ran off, we keep hearing that there's a lot of other clear aligner companies that are...
of course. I'm actually working with one in Australia at the moment called Smile Styler. So they're launching, and you might want to look that up, Smile Styler. They're launching in March. So I think there's going to be an inundated...
Smile what?
Styler. Smile, Styler, S-T-Y-L-E-R. I know that's 3D Meditech company, yeah.
So you're starting to look at cost as an issue?
I'm already beta testing it. Look, the reality is Invisalign's made a choice, and I think the dentists aren't part of that long-term plan. We know what's happening in Canada and the US where they're setting up dental practices, employing orthodontists, and probably going alone. They're bought into Smile Direct Club. There's massive changes going on. I think we all foresee this is the corporate see this as a huge growth potential. People want straighter. We live in the era of selfies. People want straight teeth, white teeth. So the aligners become a very effective way of doing that. So I think Invisalign has made a shift. I've seen it in the last couple of years, where they've openly tried to undermine our success by helping to.
Well, did you switch? Did you switch to what did you call it? Smile stylers?
Yes. So I've been using ClearCorrect. I've been using Smile Styler. I've been using Invisalign. So it's each case has a different situation. So it's about giving the patient choice. I mean, Invisalign is a established brand and it's a great product, but it comes at a significant cost. There's no question about that. So it's about choice. If there's a case where there's an alternative, then it's offered.
I'm going to go back a couple questions. Did you switch to ClearCorrect and looking into Smile Stylers because it was less cost, or because you found it troubling that Align Technology, which owns Invisalign and iTero, bought a significant chunk of Smiles Direct Club and are basically weeding?
I think it's both. I think it's both. I think the reality is, I've been interacting with Invisalign for a long time to look at assisting with their software to show, tooth augmentation. So we're not just showing an alignment, we can also show augmentation of teeth with their software, and that just kept falling through. So I've been approached by other clear aligners to look at, with my expertise, what we can do to help in that area. So I've been beta testing a number of products, and usually I'll test it on myself. I'll wear the aligners on myself. So the ClearCorrect, unfortunately, is limited in what it can provide, as far as I'm concerned. But Smile Styler does show potential. I've finished a few cases now. Within 6 months of beta testing with amazing results that I wouldn't have even thought about using with ClearCorrect, but would be comparable with Invisalign. And I think all those factors you said, cost as well as the shift that's happening globally with Invisalign, means that we need to look at further alternatives for the consumer and for ourselves as a profession. I mean, competition.
What's the population of Australia? What is it, 26 million?
Yeah, pretty much, 25, 26 mil.
Of that 25, 26 million, when they come in and they want clear aligners, what percent of them say, no, it's brand specific, I want Chanel No. 5, I want Invisalign, versus you can talk them into just a clear aligners and it doesn't matter if it's ClearCorrect or Smile Stylers?
That's a good question.
Yeah.
I think what we've seen is patients who come in already informed. They've done their research. So for us, the patients come in because the orthodontist down the road told them they need braces, but they've heard about clear aligners, whether it's Invisalign or not. So I think for us, it's hard to give you that assessment because the exposure and the marketing is really Invisalign based, despite the orthodontist telling patients otherwise that it's only fixed. So it's a hard one to answer. I think it's only going to grow as social media taps into this. So I think for the under 40s, the under 30s, this will exponentially grow. I think it's an untapped potential. So to give you that figure, when a patient comes in, I'd say there'd probably be a third that are brand based on their research. I think the rest would be open to a cost-based product if they can see and see results, comparable results.
So you're saying one third of the market is brand specific and wants Invisalign, and 2/3
they're wanting aligners. I'd say would be open to based on cost. It's based on cost. It's a cost-driven market. Patients come in, they shop around. So it's a pretty obvious fact, especially with the aligners and orthodontics. Patients that come and see us have gone to 3 or 4 other places at minimum, and that's by online shopping. They'll go on, they'll search, they'll inquire by price, without even having their teeth, but that's the perception. So I'd say 2/3. Sorry, go on.
So you say a third specifically want Invisalign, but 2/3 can be talked for price to go to generics.
Of course, based on what's happening at the moment. They go online, and Invisalign has a huge online presence. So a third are sold on that. It's a tough one because these are people who are already shopping. But what we've seen is those that come in price is always an issue. 2/3 have to be convinced that Invisalign may be the only option rather than fixed orthodontics, which is, a bit more affordable. And some even go down fixed orthodontics based on price. There's a huge potential demand for an alternative product that can be used effectively because of price. No question. And that's why the direct-to-consumer concept, it's just started in Australia. There's talk about a few trying it or trialling it up north in Queensland. So it has potential because patients want affordability, they want predictable treatment, and they want it now. They want it quickly and they want it now. That's our challenge as dentists, to be able to provide choice and option and balancing all those health and needs that are required.
Well, my dental office just turned 30 years old last September, so I've seen this rodeo before. I remember when bleaching could only be done at the dental office. And then Crest white strips, they came out with a $50 box. So, and in-office bleaching is still here, and over-the-counter bleaching is still here. Another thing you mentioned in your bio, that when you teach and speak and mentor at the postgraduate school of dentistry, you not only do you talk about 3-shape trio central scanning, but also 3D printing with Meditech. Are you printing your aligners? Or?
No. So 3D Meditech is related to Smile Styler. So it's the Smile Styler is a Melbourne group that are now printing their own aligners. They've got a high-tech facility where they're printing the aligner. So the 3D Meditech is related to the Smile Styler group.
Okay.
Where I've been beta testing.
Are you doing any 3D printing in your office?
Not yet, but I foresee it will be a matter of time.
And
we've got a milling unit. We've got a roll and milling unit for our porcelain restorations. So we've set up a lab at our practice because we do so many retainers. So we make our retainers in-house. With Zendura retainers or whitening trays and splints and so forth. So we have a full-time technician on site. So we've got a milling unit for that. But I foresee that will be replaced with time with some form of a 3D printer. Now, whether that means printing in-house aligners, I think that's potentially where it's heading. If the software is able to be done, where you can, the 3Shape software, you could technically do that manually yourself if you had an accurate enough printer. But these printers that are currently there, are pretty expensive, and that's why it's a centralised printing process at the moment, whether it's Align or 3D Meditech or otherwise.
What do you mean when you talk about systemizing your clinical practice?
It's about the efficiency. So, we talk about communication and technology, integral parts of what's been successful for us. But the systemization is every team member plays a role in the administering of these aligners, whether it's the nurse taking the photos and the scans, it's the admin staff assisting me uploading the data. So it's a systemized process because all I'm focusing on is meeting the patient, diagnosing the situation, ensuring they understand their options, using the software to treatment plan. And then it's a team of providers, nurses, receptionists that ensure that it flows well. So that's the systemization of aligners at our practice.
When I survey dentists on Dentaltown, first of all, when you're on Dentaltown, 250,000 dentists on Dentaltown, when you start a thread, you can actually start a poll. So you could sit there and start a question and say, do you prefer ClearCorrect or Invisalign? Vote. And then you vote, and then you get to see all the replies afterwards, all that stuff. But whenever we poll them and say, what stresses you out the most? It's never figuring out whether you should use Invisalign or ClearCorrect. It's never about what bonding agent. It's always staff. They say the staff drive them crazy. It's so stressful. After they get done doing a root canal, they just run in their office and lock the door. They just, how do you coach dentists to be better leaders with their staff? I mean, did you just naturally love it? Were you like that guy in school, Mr. Personality, or did you formally teach yourself?
It was out of necessity. This growth that we had was based on this, we started to see this untapped potential. It became an afterthought. I spent 10, 15 years with the growth that we had, trying to work out how was I going to deal with this. I mean, I go home once an hour, once a night, spending time on about 20 cases. So I've had to deal with the problem we've had, the growth that we've had. So the staff were there to assist. So it became a necessity. I was sort of forced into a situation where we had to find a way to manage our success, and it was with the people. So that's how it came, because I agree with every dentist that you survey, dealing with a team and with the turnover of nurses that you get, especially this generation, it's a constant issue. So the training had to be there. And you got to understand, when I was doing what I was doing, the dental profession didn't believe Invisalign worked. I had to convince my own team of what we were doing and the success we were doing. And until they saw the results, they believed. The hardest people as part of this team and the systemization of what we do is actually the dentist. You know, the nurses, receptionists, they have checklists, they have a you know, a job description. They know that, and they're empowered because they're part of that process. They're not just sitting there using suction. They're there helping that patient on their journey, coaching, motivating that patient. So it's the dentists that have been the most difficult part, to help them be part of a team approach to dentistry rather than an individual with their own book. So it's not been easy. I'm not saying I have all the answers, but I've had to work hard at creating a process that everyone feels part of that team and helps the dentists grow and develop as well.
Well, I've talked to several dental school deans with this. Jack Dellenberg was a leader in this. So was Art Dugoni at UAP, where, you know, when all the dental schools only accept you on whether or not you got straight A's in chemistry and physics and geometry, you really end up with a really freakish oddball. And when you look at someone in undergrad who was well-rounded, maybe they spent a lot of time volunteering, or maybe they had a girlfriend, or maybe they had a sick parent that lived in the same town, and they start making just average or above average grades, well, they don't have a chance of getting in dental school, med school, or law school. So you just come up with these weird freaks. I mean, you know, there's just, I mean, your average dentist, physician, lawyer is totally different than your average business communications major at a college, and so they're hard to manage. And also, you spoke about this generation with turnover. I mean, like, my mom's brother got a job at Mobil Oil when he was 16 and retired at 65, and almost all my friends that are my age, their dad did the same thing. They got a job at GM, Chrysler, Ford. They stayed their whole life. The millennials, they think their whole life is about 2 years. I mean, their turnover
exactly right.
is crazy.
Yeah.
1-300 smiles.
No loyalty. There's no loyalty.
1-300 smiles, and the other one, what was the other one? Pacific Smiles. They're publicly traded, so you can see what their staff turnover is, and it's 20% a year. So how do you deal? And you're saying the dentists are harder to manage.
Absolutely. And
staff turnover is tough. How do you deal with managing dentists? How do you deal with staff turnover? I know what we do. I mean, I probably can't say this. It's going to be used against me in court. But if I get 5 applications and 4 of them are millennials and 1 of them is a baby boomer, well, I guarantee you where I'm going. I mean, if I hire a dentist 45 years old, 40 years old, they'll stay with me 10 years. I hire a 25-year-old, they'll stay with me 1 to 2. Same thing with dental assistants. I mean, older people, the baby boomer generation, they stay put. The millennials they're just off to the horse races.
But that's where the systemization approach is effective. I would take the millennial because they can embrace that technology far better than I can, or you and I can. So it's about the technology. So if I get a millennial for 3 or 4 years, and I do, and I've got great staff that are 5 years plus, that are the core of the practice, that believe that what we do and embody the freedom dental philosophy, it's gold. So it's about the systems, right? Patients come in for an expected customer service experience. It doesn't matter who the dentist is. It's not about me. You know, I don't want dentists replicating me in the surgeries, but they have to have that ability to embrace technology, embrace the communication and transparency. So it's about the training and setting the philosophy and the culture of our practice. That's the key. So it's about attitude. I don't look at the skill level of it. And one thing I do not get involved in recruiting a dentist. I gave that up a long time ago because I don't have a clue in that process. Our best dentists at our practice have nothing to do with me. It's about recruiting for culture and attitude. And that's been the key to our success. So you have a training plan in place. We have internal training, and that's where it's evolved, because there's growth. We had to have certain standards in place of customer service, protocols, and checklists. So dentists don't have to abide and follow protocols, whether it's a clinical treatment. We have what we call a SAC protocol, simple, advanced, complex. Pretty simple, where dentists or oral surgeons look at an implant and say, what are the factors that are going to make this, simple, advanced, complex? We use that for every aspect of each dentist's ability to do treatment. So they have the ability a junior dentist to grow based on knowing what they can and can't do and learning and evolving. So it's a training and development that we put into our team. That's the answer to the turnover, whether it's a millennial dentist or millennial nurse or therapist, oral health therapist. So that's the key to long-term viability for us, is putting training back into them.
Now, is this what you call your aorta, AORTA, your advanced?
Yes, that's evolved from that. So aesthetic, orthodontic, and restorative training academy.
Now, is that just for your staff, or is that a website for other dentists?
No, we've been open and have been training other practices based on lectures and also hands-on training, where they come and spend a day with us and observe our protocols and for the team. So it's a team approach. So we have sessions for dentists and therapists, but we also have the ability to train up teams with the nurses and receptionists, because that's the key to us. It's not about the dentist. It's not about just the dentist. Aesthetic orthodontics is a team approach. So that's how we train them up.
So do you have a bunch of online courses on there?
No, not online courses yet, but there's an interactive, dialogue where we bring up cases and discuss scenarios and incorporate chat and have videos of procedures being done and cases, before and after cases, where we engage conversation and try and give the confidence to the dentist to be able to perform and troubleshoot scenarios that they'll come up with.
So what procedures do you do, or what procedures do you not do? Obviously, you do ortho, cosmetics, bleaching, bonding, veneers. Yes. Do you do implants, root canals, extractions, kids? What else do you do?
So we do the works at our practice, but I don't do any surgery implants. My focus is on the restorative, prosthodontics. So I have a team of providers that can place implants in. We have a CBCT unit at our practice. So, we treat and plan together. So I'll do the restorative, I'll do the surgery, or they'll do both. We have dental practitioners that will do wisdom teeth extractions, pediatrics we do. So we try and cover all bases, sleep apnea devices we also do. It's a comprehensive team, but we all have our strengths, and that's what we work together to abide by. So I don't do everything. I have a team that can do things better than I can, so I will refer my patients to my associates, whether it's a wisdom tooth or otherwise. I'll focus on what I can do. And I think that's been the key, having a team approach and providing services for the patient at one place.
So what do you think when you say you have a spa, a dental office spa, what percent of the market understands that, or what does that mean to the market when you say you're a spa dental office?
So I think it's how it feels. I think it's the key. It's the ambience. It's how it feels when a patient walks in. It's the smell. It's the sound. And I think that spa is that connotation. So we have our own brand of candles with our own scent that we've created. So a patient comes in, they know they're at freedom based on how it smells. And these candles are gifts that we give to all our new patients. We're renowned for our candles, and that's been something that's evolved. And I can't tell you, often I'm at trade shows where a rep will come up and say, "Oh, where are you from? Freedom Dental." That's what the candles are. So it's the ambience that we create. So that's what the spa-like environment is about. All our equipment is built behind, so the patient comes in, it's a standalone chair. And there's always, we have TVs on the ceilings that have Netflix or movies or, TED Talk, whatever it may be. It's all about the patient. There's built-in laughing gas, RA. So it's about that spa. So they don't feel like they're at the dentist. That's our goal.
When you work on children, do you put the laughing gas on the child or yourself?
Look, I'm sure there's days where we all feel like putting it on ourselves first, but no, of course.
How are you finding, what is your go-to marketing? When you're marketing and advertising in this dental industry, what do you do in print? Is it location? Is it billboard? Is it Facebook? Is it Google AdWords? What are you doing for marketing?
Yeah, it's a combination of all of the above. I mean, it's constantly changing. I think the effectiveness of Facebook for us was 3 or 4 years ago when no one was using it in Australia, or 5 years ago. Now, everyone who puts dentist as their profession, you have an ad every 5 minutes from a dental practice all over Melbourne. So I think it's constantly changing, but I think it's word of mouth. The social media is in essence a word of mouth platform. So it's tapping into that, and it's online communities that you want to be embracing. So nothing works better than a happy patient giving you 5-star service. Simple as that. And there's forums. I mean, I know of a forum that I've never seen, but it's apparently in Australia, the IT's professionals forum called Whirlpool. The amount of patients I get from this site is incredible. And these are always these IT geeks, analytical, who have searched based on what their peers have searched. So it's not about going out there and just spending money on Google AdWords on one. You have to do that. I guess it's the next generation of yellow pages. Google AdWords is something you need to have a presence in. But it's word of mouth, simple as that, but online word of mouth. And what does that mean? That means a bit of Facebook. That means a bit of Instagram. That means the whole thing. There's no right combination. It's up to the practitioner to look at their strengths and work out what kind of patients do they want to see. And it's often word of mouth. The patients that refer are the patients that see you because they want you. And it's like birds of a feather, flock together. And that's in essence the concept. But if you go out there and want to promote a certain procedure, how you do that is really targeting your audience. What are their age? What do they like? What do they do? That's the focus. So social media is redefining marketing for every aspect in the world, but dentistry especially. So word of mouth has been the most successful partner.
What percent of your orthodontic cases are clear aligners versus banding and wires and brackets?
I have, good question. I only started introducing fixed orthodontics at our practice because, I was tired of having to justify to patients that aligners work. So we provided fixed, and I'm amazed. I think it's about 5%, 10% and growing. It's only been the last 3 or 4 years that we've had a dentist who does fixed orthodontics and who now does more aligners himself because he's now been there about 3 years and starts to see. Didn't believe it when he first saw it, when I was showing him the cases that we've done. Bless you. Until he saw the results. Now he's doing probably as many aligners as his fixed cases, but it's about 5%.
And are those 5% because those cases you can't do clear aligners, you just need to band and bracket it up?
No, it's patient choice.
Patient choice?
And that provider's perception. So if that provider has seen them, so we provide them both. We'll offer them both the aligner and the fixed orthodontic with the pros and cons. Now, I'm not saying Invisalign is all-encompassing, but it's getting pretty close. There's not much I won't do with aligners as long as the patient expectation is there. It's all part of that. Now, if they need jaw surgery and they want jaw surgery, that's the oral surgeon and to the orthodontist to deal with. But if they want an aesthetic alternative, without having to break their jaw, we'll show them what we can do in moving their teeth, not trying to change the jaw posture. So fixed becomes an alternative. Some patients aren't going to be compliant. We have that frank conversation. If they're not going to wear the aligners, maybe braces are for them. So teenage males or someone who has poor oral hygiene or poor compliance commitments, or fixed orthodontics is still a viable option. And that's why we see those sort of numbers. Or patient belief. At the end of the day, patients have a belief system. What they read online, what they hear from an orthodontist they spoke to 5 years ago, 5 months ago. So those patients believe fix is better and they want fix. We provide it for them, but it's patient choice. Now, A to B, what car is going to get you there better? Doesn't matter, does it? You're going to get there. So whether it's fixed or aligners, it's about the patient's want.
So a lot of dentists, they're afraid to get into Invisalign because they think the orthodontist up the street is going to get mad or not like him anymore. Do you feel any negative vibes or tension or energy from orthodontists when you're doing 3,000 Invisalign cases instead of giving it to them?
Of course. Should show you my back. There's gunshot wounds and, stab wounds. It's a fact of life. At the end of the day, I've got orthodontists who also respect what I've done and see my cases and have an utmost respect. But there's orthodontists, I don't blame them. They've spent 3 extra years in Australia doing a master, doing their postgraduate studies in basically learning how to bend a piece of wire and the effectiveness of bending a piece of wire. Then all comes along this third-party provider taking away from them. They're angry at aligner companies, and they're also annoyed at dentists doing it. But the reality is, it's not going to get any better. And for dentists to be fearful of our colleagues or our specialist colleagues, it's sad, but that's the reality. But at the end of the day, if you're quite happy doing checkup and cleans, then that's fine. If you want to provide patients service and choice and have that feeling of feeling good about helping a patient, you want to be able to learn and explore. No different to an oral surgeon being annoyed that a general dentist doing an implant. We have a license to practice and to serve our patients as long as we abide by those guidelines. I think there's always going to be part of the profession who don't want to change and like things just the way they are. And there's going to be the other part that want to grow and develop and help ultimately our patients. It's very easy to forget. We're sort of always compartmentalised as dentists. We always fix on such a small area of the mouth. We don't look at the bigger picture. The bigger picture is we're serving patients, and costs need to come down, and we need to find better ways, innovative ways to help service patients. And technology is there, ready to be taken.
Final question. Basically, dentistry is going through a disruption. Would you agree?
Massive. Exciting disruption, no question. Robotics, it's all about to happen. That's why those new graduates that are sitting in their car listening to this or wondering whether they have regret in getting into the profession, it's about to turn on its head. And they are the ones that are going to drive it, not us. It's going to pass us by very quickly. They have the ability and potential to embrace this and turn dentistry on its head.
Why do you think, what technology is going to turn it on its head? What big disruption do you see down the road?
This to begin with, the ability to take photos and be able to, there's things called, groups called dental monitoring where they want you to take photos and upload it to a database and see whether your treatment's progressing, orthodontic progression. It won't be long before there will be apps assisting in oral health monitoring. The technology in integrating CBCTs for implant placement with the orthodontic software and be able to show a patient the end result and plan from there. We'll be using more and more computers, like the technicians. We'll be using more and more technology to treat and plan, and then it becomes a more systemized process of treatment, more efficient, more effective. Yes, we've got great dentists and surgeons that can place implants in freehand without needing a guided process. But patients want reliable, predictable treatment. So the technology is going to provide that. We haven't found it yet. It just hasn't been invented yet, and it will. So it's exciting times, but it's going to turn everything we do on its head. And
let us not forget that China just had the first robot place an implant.
Yes, I was talking about it last year, and the jaw drop of people in the audience. They didn't want to believe it, but that's right. It's done. It's an amazing fact to be that first person to have an implant placed in by a robot. It could be a great interview for that person sitting in the chair, how they felt having a robot put an implant in them.
Well,
but it's a great story, and it will only grow from there.
I'm mostly excited about robots because I know I will only get married again if it is a robot. I would never go with a human again. I'm just kidding.
It might even deal with the HR issues.
I know. When 3M and those companies always ask me, what piece of technology, like Sirona, they'll say, Dentsply Sirona, they'll say, what would be the most exciting piece of equipment? I say R2-D2 or C3PO. That's what I want. I want to replace all my staff with droids. Either the short squatty one. What's the short squatty one? R2-D2. And the tall gold gay one is C3PO. But yeah, that would be amazing. But hey, on that note, it was just an honor to have you come on the show. Thanks for getting up so early morning on your day off on a Saturday to come
Pleasure.
talk to my homies. I hope someday you make us an online CE course or write us an article. And the reason I love it so much is because when you travel around the world, so many countries just sit in their own country and drink their own Kool-Aid. And I have always found the most outside the box thinking when I leave the United States. I mean, I've had the most refreshing ideas in Australia and Taiwan and Poland and Brazil. And a lot of times when you're lecturing within those countries, like I was in Tokyo and a dentist said to me, he goes, man, these Japanese dentists, they don't see what's going on in the rest of the world. They don't pay enough attention to even their neighbor Taiwan or South Korea or Australia. And I love on Dental Town, I see the most outside the box thinking when it's from another country. And that's what I love the most about the internet. You know, when we put this podcast on YouTube or Facebook or Dental Town or Ortho Town, the internet doesn't know nationalism. They don't know where the boundary stops. And listening to you down there is great. And I just want to say one last thing with the Americans. My brother lives in Sydney, and I've been to Sydney so much, even more so now that my brother lives in Sydney. But I mean, I think it's probably the only country where I could leave the United States and go and come back. Every time I visit my brother always says, Howie, why do you want to go back? And I go, I know, but I got 4 kids and 4 grandchildren, 2 walking, 2 in the oven. But you know what? If I was a bachelor and I had no ties to the United States of America, there's no way I wouldn't leave Australia. And on that point, I know how competitive it is down there. I think it's more competitive than any place in America. I don't know any place in the United States of America. I mean, just out of nowhere, double the schools, let in 1,000 dentists from like South Africa and all around the world, and then DSOs and corporate landscape, yet there's still guys like you just crushing it. So anything's possible if you're willing to do the work, put in the hours, have the passion, and most importantly, what you said, a commitment to the customer, the patient, a patient-centered practice. John, thank you so much for getting up early and coming on my show today. It was an honor to podcast you.
Thank you. Thank you for having me.
Next time I come to Melbourne, you'll have to have a beer with me and my brother.
For sure. I'll come up to Sydney. Definitely.
Okay. Have a rocking hot day.
Will do. Thank you. Thanks very much.